We are thrilled to be joined right now by Kathy Lipton. Kathy Lipton's from Optum. Welcome, Kathy. Give it up for Kathy.
Welcome.
Thank you.
We're so happy to have you here. So let's jump right in. Tell us more about Optum and what you do.
Okay, I'd be happy to. I'm the National Medical Director for Senior Community Care, which is a segment of Optum Health Home and Community Care. Optum Health is a leading information and technology enabled health services company. And the goal is to modernize healthcare services and make healthcare work for everyone. Within that, then, home and community care is focused on home delivery for complex medical, behavioral, and social need patients. And then senior community care, in turn, is my segment, and we focus mainly on all aspects of senior living. In particular, we have Medicare Advantage plans for special needs plans for seniors that live in nursing facilities, assisted living communities, as well as senior housing.
Oh, that's awesome. I'm going to have you pull your mic just a little bit closer to you,
Sure.
only because I think someone won, they spun a wheel back there and won a big prize. I heard some hooting and hollering.
We want to make sure they hear
Which is part of the expo experience. So tell us, you kind of gave us the what, right?
Yeah.
So tell us a little bit about why. What gets you excited about going to your job every day and doing the work that you do?
Thank you. So I'm fortunate in that I have been in a career in geriatric medicine, starting with clinical at Emory in Atlanta, and have been with Optum and United for many years now. I work with a tremendous group of talented and passionate colleagues from many different segments, all of whom are very dedicated to the senior population, and that's just wonderful. And also many of our external partners as well, many of whom are here today. Just everybody really wants to identify innovative ways to solve for the challenges that are facing this segment of the healthcare.
So how do you make a difference in the lives of older adults? How does your company do that?
Our programs are based on empowering primary care at the bedside, regardless of where that home and bedside is. We rely heavily on our advanced practice clinicians as well as our physicians, and the goal is that there is a longitudinal relationship with the patients, the families, and the caregivers. So, for example, in the nursing home, that would be the nursing home staff. In the assisted living environment, that could be the caregivers there. And really get to know our patients so well that they can pick up early changes in condition and address them, ideally bring providers and resources to the bedside to stabilize situations and avoid having to transfer to acute care facilities, emergency rooms, and hospitals. And oftentimes, these folks do very well in their homes where they're comfortable. This is, of course, in keeping with their advanced care planning and their goals of care.
Yeah, so staying on top of it early, basically. You just hear that across the board in healthcare, like early detection for everything, or having a plan early and going out there. That's fabulous.
The other thing about that, too, is making sure that everybody is involved. So not just the patient, but again, the loved ones, the physicians, the caregivers in the buildings.
Well-rounded care.
Yes, and everybody being on the same page, knowing this is what the family and patient wish to have happen, and that's how it works, and it works well.
Oh, that's great. Yeah, having a plan makes all the difference. And what are you excited to talk about to people who are stopping by your booth? So I'm Joe Schmo. I'm looking for some free candy. I come by your booth. What are you going to tell me that will just light me up?
And what are you going to give us?
That's right. Well, so everything's Optum Orange. So there are Reese's peanut butter cups,
okay.
and also clementines for the healthy factor.
Yeah.
So we got the little bit. To me, it's extremely important for us to have a presence here. We want to sort of have a finger on the pulse of what's going on in the industry, understand what the issues are. So we're as interested in going around and hearing from others as they are to come and talk to us. We'd like to hear if they have questions about our programs and what we offer, as well as see what the innovations are that are going on in this sector. I find it very empowering to be with another, basically thousands of people here who are interested in the work that we're doing, and we in the work that they're doing. So.
Do you hear that? So visit the booth, because you can actually
number?
tell your story, right?
Right?
They can tell their story.
Our booth number is 2723. Again,
2723.
2723.
Stop by. So, what are your organization's goals in aging services spaces, and how are you all getting to those goals at Optum?
Our goals are always to try to improve on what we've done before, to evaluate what's working and do better with, learn, gather data, and try to innovate. We are doing a lot of interesting things. For example, one of our plans, our assisted living plan, we are moving beyond the assisted living borders now, and we're able to offer that plan to seniors living in senior housing and touch more lives. Our organization is also very interested in value-based care and getting away from the old fee-for-service, which does not really work very well in this space, and into a more fee-for-value, and really trying to encourage our practices to look at outcomes as opposed to just kind of generating visits and that sort of thing. We also are looking at machine learning to improve the data that is being delivered to our clinicians, make it timely and accurate so that they then can do a better job taking care of their patients.
That's great. So Optum is a big, in a good way, a big machine, connected even to United Health Group still. And so does that help to have such backing, to have such a big umbrella kind of across the whole healthcare spectrum?
It's really tremendous, and there are so many, and Optum and United continue to grow and diversify, and that just makes us all better. Yeah. And there are people, much smarter than I am, trying to figure out, what's the next acquisition or partnership that will just strengthen what we can bring to our clients and our partners. So it's a little daunting how big it is,
right.
But healthcare, of course, is a local endeavor. So there's always that back and forth with corporate and the markets to make sure that we are meeting the needs the right way in the right environment.
Yeah, I've been to a couple of Optum conferences myself, and it's interesting. Sometimes I think our mindset goes, big is not necessarily good, and then I'm at these conferences. Big is great. I mean, what is going on there is just to get a peek behind the curtain of what's happening there is really awesome. You're with a great team. So I've done this to everybody here. Done a little research.
Stalked you.
Yes, I'm already. Earlier I called myself the doughy Anderson Cooper, and I'm sticking with that. Did a little research on LinkedIn. You've been in this business for 30 plus years.
Wow.
And you know what? It's easy to get kind of wrapped up. Even as I get a little older, I'm thinking it was better yesterday. Everything was better 10 years ago. But that's not necessarily true. Can you give us a little of the positive? What in your time, in this 30 years in this industry, what has gotten a lot better, or what accomplishment do you see over this 30 years where you're like, we're in a great place?
A lot of things have gotten better. One in particular, though, I would highlight is what used to be what nursing homes, were like. And it was the rule, not the exception, that most of the people that lived in nursing homes would be sort of shipped out to visit their physicians, visit specialists. No one ever came to the facilities.
Oh.
And they were sort of lonely places, and they were depressing.
Yeah.
So what has happened over the last 20, 30 years in terms of not only the physicians, the advanced practice clinicians, those who are really dedicated to this field, and they are coming to the bedside, they are being part of the environment, and just, this is the end of people's lives, and,
right.
Making that quality of care happen in their homes, and, music therapy, and all the wonderful things, volunteers. It's a much more welcoming place. And
not
it's
such
just
stale care.
Right, and not lonely, and it's just very rewarding to see that.
Yeah.
That's awesome. Kathy, this has been, if you don't mind me swearing, a ding-dang pleasure to have you up here.
You.
Kathy Lipton from Optum, everybody.
Yes,
Give it up for Kathy.
Having you. Pleasure
Thank you
having
so
you.
much
Thank
for
you.
being here.